Hello, my name is Jodi Scholes. I'm your instructor for the MBLEx review course. Welcome. Let me make sure you can see everybody. Yeah, you can see everybody. Yeah, so here we are in live class. We are studying for the MBLEx, the Massage and Bodywork Licensing Exam. Yes, we are. The finish line. The finish line that's really a starting line, right? So the finish line will be passing the MBLEx. Today's class is navigating the body. Wanted to give you a little bit of a framework. Navigating the body is the anchor of your learning. Whenever you're feeling a little like maybe disoriented, come back to the foundational learning of navigating the body. Much of what we'll talk about today will sound familiar. However, that just means you've learned it. Today, we're focusing on the lower body. So we'll be talking about anatomy, physiology, and also some kinesiology of the lower body. Yeah. So navigating those regions, getting super clear on the movements of the lower body. And that is the foundation of your learning, because it is really, really hard to answer anatomy questions if you don't know your way around the body. Yeah, so we're going to get really familiar with that today. Class happens in 3 parts. Those 3 parts is the first part. We talk about some test-taking strategy. Yeah. Second part, we are learning. And then the third part, we're dissecting questions. All right. And so the test-taking strategy for today is a part A and a part B. So part A is understanding how to best use our program, the MBLEx review course. And many of you have been with me for a little while, and many people ask questions as far as, oh my goodness, like, how do I do this? Or what is that? Where are the classes? What practice exams? Wait a minute. So I want to, in part A, outline for you the big picture of this MBLEx review course. And then in part B, we're going to take a look at exactly what to study. Because that's the other big question I get. How do we know what to study? My goodness, you got books piling up and workbooks piling up. And it's like, there's so much in there. Seems like a lot, but we'll clarify that today. But let's start with part A. The MBLEx review course is a course that I have designed the curriculum to reflect exactly what is on the Federation content outline. So, a lot of big words there, right? The Federation. The Federation is the FSMTB. Yeah, a lot of letters. So the Federation of State Massage Therapy Boards is where you register to take the MBLEx. One of the resources they provide is a content outline, and we'll take a look at that content outline next. This curriculum that you're going through is in 8 parts. 8 weeks for some, 4 weeks for some, 8 days for some. Depends on when you have your MBLEx. 8 hours for some. No, not quite that quick. But I have 8 classes that reflect the content outline. And we'll again take a look at that content outline in just a few minutes. However, we work through an 8-week cycle. Each week on Thursdays at 12 o'clock Eastern, 11 o'clock Central, it's 10 o'clock in Mountain Time. And if you're out in the Pacific, if you're from Arizona, there's a bunch of you. Hi, it's 9 a.m. But 12 o'clock Eastern, we meet, we gather, and I teach a live class. I really love to teach. And for me, when I was learning, I really needed the visual. I needed someone to explain it to me. Once it was explained to me, I was like, oh, okay, that makes sense. So that's what we do on Thursdays. We come together for live class. Each week is the next section of the content outline. So for example, next week is benefits of massage. We already know.
Okay.
Benefits of massage. So we already, and that's something that is going to be 15 questions on your MBLEx. So the content outline we're about to see will tell you exactly how many questions are in each category. So each week, my live classes reflect one of the sections, one of the core curriculum, one of the sections of their outline. Now, with this class, if you are at the $20 a month level, you get unlimited practice exams. You can take as many practice exams as you want. If you don't pass, the class automatically resets. Passing is a 70. I know it's a little bit of a stretch and it's a tough test, but if you don't pass, no big deal. It automatically resets. But when you finish the class, there are two buttons. One button that says review test. You can go ahead and review your test right then and there. There's another button that says continue. That resets the exam. So if you hit that review test button, you can save a copy. You can review it right then and there to see which answers you had challenges with. Yeah. But when you're at that $20 a month level, you get unlimited practice exams. And if for some reason you don't see your practice exam on your dashboard, send a little message on over. We'll get you squared away and we'll help you to find it, or we'll reset it for you. Every now and then, students take 2 or 3 days to take a practice exam. I'm okay with that. I might. But when that practice exam is open for 2 or 3 days, sometimes it gets jammed. Sometimes I think, they're not coming back. Well, and it's just a cycle we have to reset. So again, send us a little message. You're in the Patreon system. Send me a direct message. Let me know, hey, I can't find this or this, or where do I find that? And we'll be happy to help. So for those of you who are at the $49 a month level, you get all the unlimited practice exams and 8 additional lectures. Now, what's the difference? It's like, why do I need the classes? I come to this class. The classes online in the Online Learning Center are a full hour just on content. So I talked about benefits of massage. So next week before class or after class, you could watch the benefits of massage lecture, the long one, the 1 hour. Additionally, those $49 members, you get 8 quizzes just on that topic. So if you've just studied benefits of massage, all of your questions are going to be about the benefits of massage. Okay, so part A, section A of our test-taking strategy is really understanding our system. So we've got a $20 level, a $49 level, and bonus, the $99 level. You get everything that the 49ers do, but at $99, you have prepaid for 1 tutoring session with me. So, and we get that scheduled. We go 1-to-1. We can tutor on a subject. We can do a pep talk before your exam. We can use that however you think it's best for you. So that was part A of our test-taking strategy for today. And now I'm going to go into part B. And part B is reviewing the content outline. I mentioned that the Federation has a list of the content that will be on your exam. Let me show it to you. Just take a quick breath, take a quick sip of water. If your hair feels blown back, That's good. That's a saying that just means whoosh, we just covered a lot. Yeah, we're going to get more specific now. We're going to concentrate on the lower part of the body, identifying some muscles and the movements in the lower part of the body. So here is topographical views of the lower part of the body, right from iliac crest to the knees. Take a peek. Our erector spinae group, sometimes called the ESG, either side of our spine. See that nice little divot right there? That shows you where those erector spinae start to go up. What do? Look at the name here. Erect spine. Erector spinae. They keep the spine erect. They support the spine. All right, well, right here is that crest. We'll see another picture of the crest in a moment, but this is the region, the PSIS. If you were to put your hands on your back, if you came around and put your fingers around on just at the rise of your rump, just at the rise of your butt, right there, you'll feel that posterior superior iliac spine. It's on both sides. Yeah. And this is the iliac crest, but there's a very specific point on the crest, but the iliac crest is right here. Posterior, superior iliac spines. Basically the same thing we're talking about, basically. All right, we know where the sacrum is. At the bottom of the sacrum is the coccyx. This is also called the gluteal cleft. You know, some people have a cleft in their tongue, in their chin, right? Like that little cleft. This is called the gluteal cleft. And we name it because draping does not expose the gluteal cleft. If the gluteal cleft is exposed, it is considered improper draping. Yeah. Did you get that in school? Secure that drape. I don't want it to move around. Tuck it in. Tuck it in. Tuck it in. Yeah. All right. So gluteal cleft is not exposed. Got glute max. Got the gluteal fold. I imagine this if it was a baby's butt. Remember how fun is the little fold for the little babies? Hamstrings. Hamstring tendons attach here. Got some popliteal fossa. That's right. Popliteal fossa. That's right behind the knee. Now, just want to make mention, it is a contraindication. It's an endangerment site to work directly behind the kneecap. However, where do these hamstrings attach? Zing, zing. Look at that. Right there on the side. So it's awesome to work the sides of the knee. We don't want to work on that fleshy part in the middle, but on the sides, it's like super tight. And so also in the front, lovely to work the sides and the front, even though this popliteal fossa technically is an endangerment site. All right, moving along. Let's explore fascia and let's define fascia, shall we? Because we throw fascia around like in different ways. And every now and then I hear it used and I'm like, oh, that's not exactly what fascia does. So fascia is a slippery layer of tissue immediately under the skin. It surrounds organs, muscles, bones, all sorts of things. It actually surrounds almost everything. It's what allows our gliding to happen, like when we do petrissage in this picture here in the upper right. So it's what allows the muscles to move and to glide. Yeah, fascia. So you may have been exposed to fascia with a pathology called plantar fasciitis, itis, inflammation, right? Arthritis, bursitis, plantar fasciitis. It's inflammation of the plantar fascia. So that sheath of fascia that's under the foot. Remember, we talked about plantar flexion, pressing down on the gas pedal. Sometimes when people walk or run, they'll feel pain in the arch of their foot. They'll be diagnosed by a doctor with plantar fasciitis. That means their plantar muscle, the fascia surrounding the muscle, is inflamed. Let's take a little closer look. We think also of fascia. Let me show you this picture first. So these are the layers of the skin. And so there's deep fascia here under the superficial fascia. But we've got the epidermis, right? Remember from our integumentary system? This is a hunk of skin, all right? So we've got the epi, like an EpiPen, epidermis, the top part of our skin, right here. We've got the dermis. And then underneath the dermis, in fact, you can see it here, skin, they lump it all together. There's this superficial fascia. There's deep fascia that is right on top of the muscle tissue. And I wanted to also mention that this fascia surrounds our abdominal, like our organs and our abdominal cavity. It's the reason the skin on our belly moves, because the skin isn't stuck to the stomach. There's a layer in between of fascia that allows the skin to move. It's the reason that your skin moves, right? Do this if you're not driving or operating heavy machinery. Yeah, you can move your skin, right? Unless, of course, you've got scar tissue. Now, okay, hang in there with me as we dissect some questions. Yay, good work today. A lot of review of that lower body. Nice work. Okay, let's apply it, shall we? Blank is a continuous network of connected tissue sheets that surrounds and supports every structure in the human body, including bones, muscles, organs, nerves, and joints. So, a little bit of a long question. Breathe into it. Blank is a continuous network of connective tissue that surrounds and supports every structure in the human body, including bones, muscles, organs, nerves, and joints. Muscle tissue, skin, the integumentary system, tendons and ligaments, fascia. Ooh. Give a shout out for last time, Yolanda and Candace, yes. Ooh, Ashley's got a good guess. Yolanda's got a good guess. Greta's got a good guess. McKaylee, yeah. Sharita. Yep, iPhone 5, you're in. Zoom user. Oh, that's Marcia. Hey, Kadeem. Yep, you nailed it. Ren, good. Tammy, yep. Body KK, uh-huh. Patitia, yes. Candace, yes. Chrissy, yes. Very good. Let's get rid of one wrong answer. Okay, because we're gonna practice our strategy. So let's get rid of one wrong answer. It's not muscle tissue. Best answer? Boom, fascia. And I took this word out of the question, the original question, but fascia surrounds our muscles too. So, and if that threw you off a little bit, like you didn't see muscles, then now you know. Next question. The third eye is blank to the heart chakra. The third eye is blank to the heart chakra. Inferior, medial, distal, superior. And one way you could also use this text-taking strategy is put the word in the blank. The third eye is inferior to the heart chakra. The third eye is medial to the heart chakra. The third eye is distal to the heart chakra. The third eye is superior to the heart chakra. All right, let's get rid of one since we have a bunch of answers already in. We're going to get rid of distal. Distal is used to talk about bones, usually not about chakras. All right, let's look in the chat. What do I see? All right. Ren, Tammy, Patitya, Christy, yes. Kareem, yup. Shrita, yup. Garcia, yup. Zeke, you got it. Maya, yeah. Yolanda in. Ashley in. Tammy in. Yes, yes. Christy, good. Good. Candace, Ren, yep. 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 Yes, Diana. Thank you. And McKaylee. Good. Best answer, superior. The third eye is superior to the heart chakra. Good. Throwing two things at you there, chakras and direction. Ooh, yay. Great work today. I see it in this picture, there's somebody building a brick wall, a cement wall. That's what I mean. When we spend this kind of time together, 90 minutes today, that's another brick in the wall, man. And every hour matters. Every hour counts. Want to mention as we close off this series today that the intro class on August 27th is happening for our business mentoring. This is only available if you've passed the MBLEx. But this is a sample of what we're covering. I'll come back to this slide later for the people who are with us. But for now, I just want to say thank you. Great work today. Let me stop that share and say, bravo. Woo! You hung in there. And part of what we need to do is to build our test-taking stamina, right? I mean, we got to build our test-taking stamina. And that's what we're doing today. We're building our test-taking stamina. So great work today to each and every one of you. Thank you for making time to be here. Thank you that you want to be a massage therapist. It's awesome. The world needs you. Yes, yes, your unique gift. I cannot give the world what you can give the world. I don't have what you have. So thanks for being a part of this. Thanks for being on this mission. Thanks for being on this journey as we prepare to comfortably, calmly pass the MBLEx. I'm going to sign off for today on the recording. My name is Jodi Scholes. I'm your instructor for the MBLEx Review class. Look forward to seeing you on another episode.